So your registrar in tertiary level neonatal unit, side room in the neonatal unit, Mrs. Cleaver, mother of 3-day-old Thomas. Thomas was born preterm at 26 weeks gestation. He is otherwise stable or on ventilator for respiratory distress syndrome. He has had a blood transfusion for anemia HB10. The blood bank technician has contacted you stating that Thomas has been transfused with wrong blood, rhesus positive instead of rhesus negative, due to an error. You have since assessed that Thomas, who remains well and stable. You have also discussed this matter with the consultant hematologist and the neonatal consultant. You need to talk to Ms. Cleaver and explain that there has been an error in the blood transfusion and how it occurred and what your management plan will be now. So points to consider: first, introduce yourself and make sure that the nurse is present. So I think in the exam this way the nurse won't be there. Preferably one who has involved in Thomas care. Ask Miss Cleaver if she would like her partner or a friend or a relative to be with her during the discussion. For the mother, it's okay, I think, but for the colleague, I don't think we should ask this question, okay, when you are telling about the critical incidents. So none of us asked in the last scenario. It's good. You need to be honest, open, and explain exactly what the error is and how it occurred. This is very important. Honest, open, and explain exactly what is the error and how it occurred. The incident is being taken very seriously, and apologize to her that this has happened. Reassure her that you have assessed Thomas and he remains stable. Preterm infants do not mount transfusion reaction. This will be your explanation to her. They do not mount transfusion reaction. There is no immediate intervention indicated according to expert advice from hematology consultant. So you already discussed, he told you that no immediate intervention. The reason is the preterm infants don't have this transfusion reaction. Their body don't have this reaction. This incident may have implication for future, as Thomas' immune system is sensitized and may produce antibodies. This situation will be monitored. So in future, he should not receive any rhesus positive blood. You can then go on to explain the formal procedure of filling and critical incident forms and informing senior nursing staff and the consultant responsible for the Thomas. The aim is to assess the risk and try to minimize any future risk to other children. She can put her concerns in writing if she feels that this is more appropriate. So if she insists to complain, that is, if she wants to put her in writing, means if she insists to complain with a written letter, offer her contact details of patient advice and liaison service. Reiterate the fact that she does not need to take this any further if she does not wish to, as you can ensure that you will be taking all the relevant steps to try to prevent this from happening again. Concentrate on Thomas being well. A mistake has occurred and this will be dealt with in order to minimize future risk. Invite her to meet with the consultant and the unit manager if she would like the opportunity to discuss the matter further. Okay, so there is something here in the notes, nothing. Okay, so you know the case. Thomas is 3 days old. You're talking to Miss Cleaver, the mother, and his HB is 10 and he has been given with RH positive blood instead of RH negative. Okay, I will give, I did not say, keep the time now. I will keep 2 minutes for you and then we will start. Okay.
Okay.
After 2 minutes, anyone volunteering to keep the time for us?
Okay, I'll do.
Who is it?
Yes, Aparajita.
Okay. I will tell you, just prepare 6 minutes and 3 minutes. When we start, you will start. Okay.
Okay, okay.
Okay. Start, Dr. Aparna.
Okay. Good afternoon, Ms. Cleaver.
Good afternoon, doctor.
How are you?
I am fine, doctor.
Yeah, so I'm Dr. Aparna, and I'm one of the doctors looking after your baby, Thomas, in the intensive care. And I would actually like to speak to you about his condition. So is there, would you like to have anybody with you while we speak about him, like your husband
No,
or
doctor.
anybody else?
No, everyone is busy. So it's okay, you can go ahead. But Thomas is fine now. He's doing fine. Is anything, doctor, you want to tell me?
So actually, I've come here to speak to you about an incident that occurred while we were taking care of Thomas in the ICU. Has anyone spoken to you about this previously?
No, doctor, you are telling an incident. Is anything serious?
Yeah, I mean, I'm sorry to say this, no one has spoken to you, but as you know, Thomas has been on a breathing machine, on a ventilator, okay, due to his lungs being really immature. Yes, and we had also found out that his blood levels were also low. Okay,
Yes.
which required a transfusion. Yes, for his condition.
Yes, they did transfusion yesterday and he's fine now. Yeah.
Yeah, so unfortunately, while we had decided to transfuse him, the baby's blood group was actually a negative blood group, and the blood that was transfused actually turned out to be positive.
Oh
So
my God, doctor, you mean I know that he's negative, he's A negative. You mean that you gave him A positive? This is what you mean?
Mrs. Cleaver, first of all, I'd like to apologize for the incident that has happened.
Oh
But
my God.
yes,
Okay, I am really
invariably,
worried, doctor. I am really worried now. Maybe my child will have some reaction and he may die, doctor. What are you
Miss,
talking? I know that wrong blood has major problems, and I have seen children dying with it. I have read it in the news and internet. Wrong blood given and the child died. And for my 3 days, poor little your hospital did like this. What is this, doctor? I can't keep my child in this hospital anymore. Please just tell me now, presently, how is my child? I want to know that.
Mrs. Cleaver, yeah, that's exactly, as doctors, we are actually very open and transparent about, the management of children. Okay, and that's why I'm here to explain to you about his condition and what we are going to do, in order to take care of him. And I understand, I totally understand, I completely understand your concern about Thomas. But however, we've checked the baby. Yes, we've checked the baby yesterday. I've just checked the baby again. a little while ago too, and Thomas seems to be doing fine right now.
Yeah, but how,
Okay,
doctor? I
so
am
the thing that you've
surprised,
been
really. You are telling that you gave a wrong blood, and you're telling also my baby is fine, and you're telling me that you give a wrong blood. Definitely, there should be some reaction. My nephew had wrong blood
yes.
transfusion, and he was given injections, and it took a lot of time to come out. I don't know. There is something wrong with your hospital, man. With all of you, I have some doubt.
Mrs. Cleaver, I'm coming to that point. What you're saying is right. Yes, in older children, these transfusions of the wrong blood group are seen to have a lot of reactions, especially about the blood cells breaking down and, leading to all kinds of problems in the body. Yes, you're right about that. But however, the good thing here, unfortunately for us, is these kind of problems are less likely to happen in newborn babies, by nature of the neonate's immune system and the kind of blood group not completely formed. We really see that these kind of reactions do not happen much. And this has also been Thomas's case has also been discussed with our the blood doctor. Yes, the senior blood doctor, and he too has also advised to just to
Okay,
monitor him. As
doctor.
such, as we do not expect much of a problem as of now, and since we've been monitoring him for the last one day, he's been doing fine right now. So that's the good thing about newborn babies as compared to what you've been saying.
Okay, doctor, but the thing is, he's newborn. He did not had reaction as you're telling, but he was little old. He would have had. Your system is not good, really. Give me the name of the nurse who gave, and I will go and complain directly right now. Please give me the name.
Mrs. Cleaver, actually, when we are taking care of a baby or any patient, in the hospital, actually, it is more of a teamwork. It is not just one person exactly who's taking all the decisions or doing all the work, So most of the
Okay,
times in
doctor,
these kind of conditions,
I will
it's like a
complain
series of error.
for
Sorry.
your whole team. I will complain for your whole team, and please guide me for the complaint, because I know the nurses and the doctors here, how can they do? And if my baby was old, he would have had reactions, and I don't know in future what will happen. So please guide me how to complain, doctor.
Mrs. Cleaver, just allow
6
me to
minutes.
explain his condition once. Okay.
Yeah,
And
3 minutes.
since we are taking care of him, in the best possible way, we are monitoring him for any kind of problems, and there's nothing much really happening, and he's completely stable and he's fine right now. I totally understand you're completely distressed about this, and you feel someone should be held responsible. But as of now, because these kind of errors do actually happen because multiple things going wrong at many steps, not just one particular person being
Okay,
responsible or the
doctor.
whole team. And we all are working in good faith. Mrs. Cleaver, we want the best for Thomas too, just as you would
Okay,
do.
doctor, I want to tell you one thing. Can I take my baby to other care? Because now I don't have trust in your care. I want to take
Mrs.
to other
Cleaver,
hospital to the baby care unit,
I mean,
because I don't trust you anymore.
would you really want to do that, Mrs. Cleaver? Because he's doing fine, and then, just transporting a stable baby for no other reason. I think you should just reconsider maybe. I mean, I totally understand the way you feel. I'm really sorry about the way you feel, but um, I think he's doing fine, and we are doing everything best possible uh, for the betterment of Thomas, you see.
Okay, doctor, now you're telling he's fine. Now maybe my child may need further blood transfusions. Then what will happen? Do you think with one
Yes,
blood
exactly.
transfusion his blood will be fine?
Yes, exactly. That's what I'm coming up to. So now that we're monitoring him and he's not showing much of a problems, so now we are actually going to look into the matter. We are going to involve. I'm going to involve my senior consultant. I'm going to involve the nursing staff, okay, and even the blood bank that's involved. And we are going to discuss exactly what happened and how does it happen. So the system in this hospital system in place is actually going to look into the matter just so that it's not going to happen ever again. Not just to Thomas, not just to any other baby also. So we are going to look after that. So I can really assure you on that aspect that if he requires further transfusions, we are going to definitely make sure that this is not going to happen in the future. I can assure you on that.
1 minute.
So
Okay, okay, doctor.
Okay, and the other thing is that I would like to tell you is that yes, in future, because of this transfusion of the other blood group, maybe we would actually have to look into monitor him even in the future, you know, regarding different kinds of different kinds of things that develop in his body because of that. So
Okay.
he may need monitoring in the long term, but as of now, he's doing fine. And I just want to tell you that the whole team is extremely sorry for this incident. And if you still feel that you need to report this, there is another system in place in which I'd leave you the leaflets about. You can make a formal complaint, inquiry into the system if you do want to.
Okay, doctor.
Okay. Mrs. Cleaver, if there's anything else you would want to know.
No, doctor, I'm only worried. I don't know. I have to.
Time up.
So the comments, we will do it later because now it's prayer time here. It will take time. There is some chat in the chat written by Dr. Satish. Okay. Okay, for me, yeah, I agree with Dr. Satish. She has written that little long you were speaking. Because here, you know, in these situations where the role player will be anxious, she will interrupt you. If you are speaking, but the role
Yeah,
player will
exactly.
start speaking. At that time, you have to stop whatever you are speaking and allow her to speak. Okay. This I was doing it. I was purposely doing it.
Yeah,
Because
so but
the
then
role
in that
player,
area, like we have to listen, right?
yeah,
When the mother is showing her anxiety, we have to actually stop and listen, right? We can't break her through and then start
that
saying
is
our
what.
own
Even
thing.
though you are talking and the role player is going to speak, just keep quiet. Whatever you are talking, just stop and listen to her concern. Because here she is more worried because she has seen some of her nephew with the blood transfusion reaction. She is applying the same to her baby. But you told, but since they will tell you like this only, that I have no trust, I want to change. So for this, the answer can be like, till now we are seeing your baby and all the records of your baby with us, and we know the baby very well. At this moment, do you want to go for a transfer? As even though this incident has happened, we are monitoring and we are taking care of your baby, and your baby is fine. But if still she insists, what you will tell? You told that when I don't trust you, I want to go to other hospital. If still she insists, after you explained that your baby is with us, we are taking care and we know about him completely till now, if still she insists, you can tell it's her right.
I think,
Yeah,
yeah,
it's
it's her
her
right.
right, and you
And
will tell
maybe
her,
I
you
think
will
we can
arrange
say,
a meeting with your consultant as well as with the blood doctor as well.
okay, okay.
Because did you read in the last what they said? If the mother is not satisfied, you can tell her that you will arrange a meeting with your consultant. You will not tell her it's your right and I will allow the baby to go. Will it be your decision? No, right?
No, no, no,
Yeah, so you
exactly.
can
That's
tell
right. So I
her,
was just trying to
yes,
convince.
it's your right. But you will again reassure her that presently your baby is fine and we are monitoring and we know completely about your baby. Till now we have taken care. So we assure you that in future also we will take care and we will never allow these incidents to happen. Uh, we will try our level best not to happen, not saying never allow, we don't know what will happen. We'll try our level best not to happen with this or even with the other child. So we'll make the incidence form and I will arrange a meeting with my consultant as well as blood doctor. Later you can tell if she is interested also. If they insist in something in complaining, it's her right. If she insists in changing the hospital, you will tell her, yes, it's your right, but before that, let's have a meeting with our consultant and a blood doctor. What do you say? Right?
Yeah, that sounds fine. Yeah.
Okay.
This is a one answer for this. Like the baby is with us for a long time, and we know best for him, and we think it is the best place for the baby to stay. And even if you insist you like to go, we can arrange you. It's your baby. It's your right.
Yeah, you're right, Dr.
Yeah,
Sachin.
that will be perfect. Like this is the best place, and we are the best, providing the best care. Error happens at every place, and we are seriously sorry for it. We seriously apologize for it, and we make sure that it won't happen again.
Yeah.
And the baby is now is doing well, and we are continuously monitoring. And I reassure you that it won't happen in the future. But
Is it
still,
okay to say that we are the best? We offer the best care. Is that correct?
Yeah. We
Yeah,
offer the
you
Are we
best
supposed to
care.
really say that?
you tell that you're the worst.
No. You
No,
because
we are just
see in
saying that we are
NHS,
working in good
What?
faith, you know, for taking care of the child.
yeah,
That's
you
what
are
we are doing.
you are in the
We don't
safe
know whether
hands.
we are the best or not.
No,
No,
you
you
have
are
to tell that
in
whatever
NHS.
you're the
In
best.
NHS, no. In NHS, if you don't say this, like they insist you like to say this, like you are in the best hands. Otherwise, patient will leave. Like not.
And also you will tell that till now we have taken care of the baby. We know
In fact,
completely about the baby, and we are doing our best to monitor him.
no.
And we will give the best care.
Even if you do a certain procedure, for example, lumbar puncture, what you say, like you are in the best expert's hand for the procedure, because this is something which is reassuring the patient. It is not something which is you have to say. Like you don't know the person who doing lumbar puncture is the best person over there, right? But you will say like we are expertized in the hands. We have the expert hand for this, and nothing will happen. But every procedure has certain risks. So like this.
Okay, so for if you people want to continue, this will be open. You can continue, but I will be stopping for 10 to 15 minutes. Okay. Or I will end the meeting. Anyone has comments to continue, or we will end and join back? Please give me.
And then join back or whatever you feel convenient, because this is your meeting, so you want to do.
Okay, we will end and join back.